Today we're going to talk about how to administer insulin to your cat. And although that may seem like a very daunting task and intimidating initially if you've never given an injection, never handled a syringe with a needle on it before, I assure you that people far less capable than yourself have been able to do this with their pets. And with a little encouragement and practice, I think you'll be an old pro in no time. Important things to know are that you're using the right insulin with the right syringe, and we will dispense the proper insulin and syringe for you, but it's always a good idea to check and make sure when you get a new batch of insulin or a new syringe that they match with each other. So I'm going to show you first the most commonly dispensed insulin as far as the units go and the matching corresponding syringe. So you know. You can see on the bottle of insulin at the very bottom it says U-100. That means that every cc, which is a volume, has 100 units of insulin in it. So you want to make sure that the corresponding syringe that you get is a U-100 syringe. And if you look at the syringe that we have in front of us here on the side, it says U-100 insulin on the bottom there. So you just want to make sure that you're using the right syringes with the right insulin. The molecule is fairly sensitive, so you don't want to agitate the bottle a lot. In fact, to shake it, to mix it up is probably not wise. The best way to mix insulin is just put it between your hands and roll it. And do that, I don't know, 7 or 8 times should be plenty. And then you're ready to go. When you're drawing up the insulin, first take the back cap off so you can move the plunger. So if you see the syringe, there's a plunger that moves back and forth. That allows you to draw the insulin up into the syringe. There's also a cap, and that exposes the needle. So you'll need to take the back off so that you can expose the plunger and also the cap to expose the needle. Once you've exposed the needle, you're going to take the bottle, making sure that it's upside down. You don't want to stick the needle in the top here because you're only going to be getting air. So upside down, the needle goes directly into the solution. Turn the syringe so that you can see the numbers, and then draw back until you get the proper insulin volume. Depending upon the cat, your dose is going to vary. Most cats will get anywhere between 2 and 6 units, and we'll just say for argument's sake that you're going to draw this up to 5. You just want the plunger to be right on the line where the 5 is. Be looking for bubbles. Sometimes you'll aspirate bubbles and you'll see little bubbles on the top of the syringe by the bottle. If there are some there, get a hold of the syringe, flick those bubbles up. And that makes the bubbles go close to the needle. Force those bubbles back into the bottle and then re-aspirate to get down to the proper unit. Once you're sure that you've gotten all the bubbles out of the syringe and you've got the proper dose in the syringe, then you're okay to remove the syringe from the bottle, replacing the insulin in your refrigerator. So we're going to demonstrate how to give the shot. Now that you've drawn up the insulin, you have the syringe ready to go. What you want to do, and again we're giving it along the body wall, is get a pinch of skin. So I generally take my middle finger and my thumb and get a pinch of skin. Then use my index finger to make an indentation. Skin tempting is what we're looking at. So you can see an angle here with a piece of skin here and a piece of skin here. Your goal is to give the injection right underneath your index finger. So with the syringe in one hand and that skin tent kind of pulled up away from the body, go right underneath your finger. What you want to do then is, with your index finger back here, is pull back on the plunger of the syringe a little bit, because you want to make sure that you're not getting any blood in return, which would mean you're in a blood vessel. If you do get blood on the return, simply pull out the syringe and repeat the procedure. But if you pull out on the plunger, you do not get a blood return, go ahead, push the plunger in, inject the insulin under the skin, and remove the needle. Your goal is to make sure that the injection goes under the skin. What I would tell you, a very important thing to do is, if you think that some of the insulin did not get in under the skin, or it has spilled out, you saw that some of the insulin has actually spilled out onto the coat or the surface of the skin, don't repeat the injection. Wait till the next injection time and give the normal dose at that time. You'd rather give too little insulin than too much. So if you think you didn't get it in, just skip that dose and wait till the next dose. But that's a pretty good idea on how to give an insulin shot. Certainly, if you're having problems, give us a call. We can set up a time for one of the techs to go over insulin administration with you and your cat specifically. Good luck, and I think in no time you'll find that this is going to be a pretty easy thing for you to do.